Welcome to our video on low cortisol, where we'll discuss everything you need to know about this condition. If you've been experiencing symptoms like fatigue, weakness, and weight loss, you might be suffering from low cortisol. In this video, we'll go over the signs and symptoms of low cortisol, its causes and risk factors, as well as effective treatments. So, let's dive in and explore what low cortisol is, and how it can be managed to improve your overall health and well-being. Cortisol is a naturally produced hormone in our body that helps us deal with stress, regulate blood sugar levels, control inflammation, and maintain blood pressure. When cortisol levels are low, it can lead to a variety of symptoms and health problems. Cortisol, also known as the stress hormone, is a steroid hormone produced by the adrenal glands in response to stress. It plays a vital role in regulating the body's response to stress, as well as in maintaining normal blood sugar levels, blood pressure, and immune function. Low cortisol, also known as hypercortisolism or adrenal insufficiency, is a medical condition characterized by insufficient levels of cortisol in the body. Low cortisol can be caused by a variety of factors, including autoimmune diseases, infections, genetic disorders, medications, and damage to the adrenal glands. It can also be caused by chronic stress, which can cause the adrenal glands to become overworked, and eventually lead to exhaustion. Symptoms of low cortisol can vary depending on the severity of the condition, but may include fatigue, weakness, weight loss, nausea, vomiting, abdominal pain, low blood pressure, and darkening of the skin. In severe cases, low cortisol can lead to a life-threatening condition called an adrenal crisis, which requires immediate medical attention. Diagnosis of low cortisol typically involves a blood test to measure cortisol levels. In some cases, additional tests may be needed, such as an ADDISON'S stimulation test, to determine the cause of the low cortisol. Treatment of low cortisol typically involves replacing the missing cortisol with medication, such as hydrocortisone or prednisone. Treatment may also involve addressing the underlying cause of the low cortisol, such as treating an autoimmune disease or discontinuing a medication that is causing the problem. In summary, low cortisol is a medical condition that can be caused by a variety of factors, and can lead to a range of symptoms. It is important to seek medical attention if you suspect you may have low cortisol, as prompt diagnosis and treatment can help prevent serious complications. There are a few natural teas that may help with low cortisol levels. Licorice root tea. Licorice root contains compounds that can help increase cortisol levels in the body. However, it is important to note that excessive consumption of licorice root can lead to high blood pressure, so it should be used in moderation and under the guidance of a healthcare professional. Ashwagandha tea. Ashwagandha is an adaptogenic herb that has been shown to help regulate cortisol levels in the body. Drinking ashwagandha tea may help support healthy cortisol levels. Green tea. Green tea contains an amino acid called L-theanine, which has been shown to help reduce cortisol levels and promote relaxation. Holy basil tea. Holy basil, also known as tulsi, is an adaptogenic herb that has been shown to help reduce cortisol levels and promote relaxation. Chamomile tea. Chamomile is a mild sedative that can help promote relaxation and reduce stress levels. Drinking chamomile tea may help support healthy cortisol levels. There are two types of adrenal insufficiency: primary adrenal insufficiency, also known as Addison's disease, which is caused by damage or dysfunction of the adrenal glands themselves, and secondary adrenal insufficiency, which is caused by a problem with the pituitary gland or hypothalamus in the brain. The primary treatment for adrenal insufficiency is the replacement of the missing cortisol with medication, such as hydrocortisone or prednisone. In addition to medication, there are also some natural treatments that may help support healthy cortisol levels and improve symptoms of adrenal insufficiency. 1. Adaptogenic herbs. Adaptogenic herbs are herbs that can help the body adapt to stress and promote healthy adrenal function. Examples of adaptogenic herbs include ashwagandha, rhodiola, holy basil, and licorice root. These herbs can be taken in supplement form or brewed into tea. 2. Omega-3 fatty acids. Omega-3 fatty acids, found in foods such as fatty fish, nuts, and seeds, can help reduce inflammation and support healthy adrenal function. It is recommended to consume 2 to 3 servings of fatty fish per week or take a fish oil supplement. 3. Vitamin C. Vitamin C is an antioxidant that can help reduce oxidative stress in the body and support healthy adrenal function. Foods such as citrus fruits, bell peppers, and broccoli are good sources of vitamin C. 4. Magnesium. Magnesium is a mineral that is essential for healthy adrenal function. Foods such as leafy green vegetables, nuts, and seeds are good sources of magnesium. Magnesium supplements can also be taken, but it is important to speak with a healthcare professional before starting any new supplements. 5. Sleep. Getting enough sleep is important for supporting healthy cortisol levels. Aim for 7 to 8 hours of sleep per night and try to maintain a consistent sleep schedule. 6. Exercise. Regular exercise can help reduce stress levels and support healthy adrenal function. Aim for at least 30 minutes of moderate intensity exercise most days of the week. If you are experiencing symptoms of low cortisol, it is important to speak with a healthcare professional for an accurate diagnosis and appropriate treatment. The symptoms of low cortisol can vary depending on the severity of the condition, but may include fatigue. Low cortisol can cause a general feeling of fatigue and weakness, which may be worsened by physical activity or stress. Weight loss. People with low cortisol may experience unexplained weight loss, despite having a normal or increased appetite. Nausea and vomiting. Low cortisol can cause nausea and vomiting, especially in the morning or after eating. Abdominal pain. Low cortisol can cause abdominal pain, cramping, and diarrhea. Low blood pressure. Low cortisol can cause a drop in blood pressure, which can lead to dizziness, lightheadedness, and fainting. Darkening of the skin. Low cortisol can cause hyperpigmentation, or darkening of the skin, especially in areas of the body that are exposed to the sun, such as the face, neck, and arms. Muscle and joint pain. Low cortisol can cause muscle and joint pain, stiffness, and weakness. Depression and anxiety. Low cortisol can cause mood changes, such as depression and anxiety. Low blood sugar. Low cortisol can cause a drop in blood sugar levels, which can lead to weakness, confusion, and seizures. In severe cases, low cortisol can lead to a life-threatening condition called an adrenal crisis, which requires immediate medical attention. Symptoms of an adrenal crisis may include severe abdominal pain, vomiting, confusion, loss of consciousness, and seizures. Thank you for watching. If you enjoyed this video, please consider subscribing to my channel for more content like this. Don't forget to hit the subscribe button and the notification bell so you don't miss any future videos. Your support means a lot to me and I appreciate it. Thank you for being a part of this community.